Hello guys, good evening. Today I'm going to explain about the radiology of upper limb. Okay, so to study the radiology, we use a radiograph sheet and film that is called skiagram. So in the upper limb, the radiograph or the X-ray are almost plane type. So first point you must say is the plane type. Okay, and next the view, that is anterior posterior view or posterior anterior view. So in the upper limb x-ray, most of the x-ray are ap view, that is anterior posterior view. Coming to the, and next you must say which side, that is left side or right side, which will be written in the x-ray sheet. You can see it. Coming to the first x-ray, here you must say first point is plane type. Second, ap view. And third, left side. And fourth, which region it is, that is shoulder joint. These are the things you must say before the examiner asks the question. Okay, now here, what are the structures or the bones you can, it is visible, is first is scapula. See, you can appreciate somewhat. This is scapula. Okay, here in the scapula, here this is glenoid cavity, where the head of the humerus articulate to form what, shoulder joint, which is ball and socket type. Okay, and next you can see the shaft of the humerus, this part, actually only this. And next you can see the superior border of the scapula, superior border of scapula and lateral border of scapula. Okay, and you can see the clavicle here, and you can see the coracoid process, and you can see the shadows of the rib. What is this? There are two types, bony shadow and dark shadow. Bony shadow formed by bones, which is radio opaque. These bony shadows are radio opaque in nature, and dark shadows are radiolucent in nature, which is formed by the soft tissues. These gaps between the ribs are called dark shadows, which appears dark in the X-ray film. Coming to the next X-ray, that is radiograph of arm. Here you can see all the features and all the bones as we saw here in this X-ray, but prominent you can see the acromion process here, this part, acromion process. Okay, and you can see the medial and lateral condyle of the humerus. This can be said medial condyle. How? Because here you can see the ulna is present medially, so where it gets attached, this condyle is called medial epicondyle. Medial epicondyle. Okay, and you can see this is ulna, and here not that prominent, this is radius. And as usual you can see the head of the humerus and neck of the humerus, shaft of the humerus and lower end of the humerus. Okay, and the same four features you must say in every x-ray which you see it. This is right type, plane type, ap view, and region is region of arm. And coming to the next X-ray, this is some clinical point of view. So here, what you can see, all you can say, that is this is glenoid cavity, head of the humerus, acromion process, superior border of scapula, lateral border of scapula, and but here the clavicle is broken. clavicle is broken. That is the most vulnerable region for the breaking of clavicle is medial two-third and the lateral one-third junction is the most vulnerable site for break of clavicle. Okay, and this is of right side they have given. Coming to the next X-ray, this is also a clinical point that the shaft of the humerus has been broken here. Okay, this is right and same AP AP plane type and right side of the. Here you can see the lateral epicondyle. This is lateral epicondyle where the ulna this radius, sorry, radius gets attached. This is lateral epicondyle. This is medial epicondyle. This is fossa. Olecranon fossa. Okay, where the olecranon process gets attached of the ulna, and here the shaft has been broken. That's it. Here also same. The shaft has been broken, and it is of lateral view. I think so. This is lateral view because if you see here, this is somewhat lateral side, so it is lateral view, and this is medial epicondyle. This is lateral epicondyle, radius ulna. Now coming to the elbow joint. This is elbow joint. Which region? Elbow region it is. Okay. Here this is AP view. This is lateral view. Okay. Here you can see lower end of the humerus, and this is radius. This is ulna, and here you can see radius lateral view. This is ulna. Okay. Now coming to the next X-ray. Here you can see still prominently AP view, lateral view. This is radius, head of the radius you can see clearly, and the neck of the radius, and this is radial tuberosity prominent, and here you can see ulna, olecranon process where it gets attached to the olecranon fossa, and this is coronoid process. This is olecranon, this is coronoid process of ulna. Next, radiograph of forearm. If you come to the forearm, you can see this is radius. How you can see? Because this lower end you must see this is styloid process of radius. This is a styloid process of ulna. Okay, and this is AP view. This is lateral, and you can also see this carpal bones, which you can. This is of left side. These carpal bones can be said clearly and visible clearly in the next X-ray here. So here you can say this is styloid process of radius and ulna, and here carpal bones. You know the mnemonic. She looks too pretty. Try to catch her. In this, she for scaphoid, L for lunate, T for trachutrum, P for pisiform, trapezium, trapezoid, capet, and hamate. Okay. Here you can see she looks too pretty. scaphoid, lunate, and here the trichotrum. She looks too pretty, and pisiform is overlapped. Trichotrum and pisiform. Okay. Try to catch her. Trapezium, trapezoid, capet, and hook of hamlet. Okay. And these are metacarpal bones. And these are phalanges. Three phalanges will be there here. This is a AP view. This is lateral view. Here coming to the, this was about the which region. It is about the wrist joint and lower part of the forearm, you can say. This region is also a wrist joint or x-ray of hand. Here you can see the phalanges has been broken here, and also you can see the dislocation of scaphoid. Most common dislocation of dislocated bone in the outstretching hand is a scaphoid dislocation. Here it has been dislocated. Okay, now coming to next x-ray. This is a normal x-ray that we discussed above. All these carpal bones, metacarpals and phalanges. This AP view and the lateral view. And this is also somewhat same. Here the dislocation has been happened. AP lateral view. And here this is about clinical importance. Same as a scaphoid. Scaphoid dislocation. And here shaft of the, which bone it is? Ulna, I think so. This is ulna and radius. Both has been broken. Okay. Here lower end. This is AP and this is PA. No, sorry. This is AP view. This is lateral view. So this is about the radiology of upper limb. In next class, I'll be discussing the radiology of lower limb. Hope you understood. Thank you.